Hey guys, welcome back to the channel. This is Phil and Emily again. I'm the occupational therapist and
I'm the physical therapist.
Alright, so today we're at the beach. We got a good one for you today because we're going to be talking about arthritis, and we had a request from one of our comments, so we are addressing this today for you guys. And we take you to the beach in Delray. It's beautiful, it's nice, it's sunny out here. So if you guys live in Delray, come join us on the beach today. It's Sunday. All right, guys, so let's get right into it. So arthritis. So this is one of the most common things that we see out of practice. A lot of people have arthritis, and it's part of the normal process of the joints. When we get older, we lose that cushion that we have in between the joints. You have cartilage.
So it's wear and tear in our joints.
Right.
Obviously, some people have more than others, and sometimes you can have it and not be symptomatic at all, meaning you don't feel any changes. But if you're active and you're doing certain activities that involve the joints where you have arthritic changes, that's typically when people will come to us for pain, decreased range of motion. More typically, pain is what is really the major thing.
Right, so you have two different types of arthritis. You have the osteoarthritis, which is the wear and tear of the joints when you lose your cartilage and when the joints start getting inflammation. And you have what they call the rheumatoid arthritis. This is when the joint is being attacked by your own cells, your white blood cells, and it attacks the synovial fluid.
Because it's an autoimmune disease. So they are very different types of arthritis.
Right. So, but there's like maybe 50 different types of arthritis, but these are the most common ones. So today we're gonna be talking about different tips and different exercises that you can do to make it feel better and to make sure it doesn't get worse, and just manage it. So first thing, with arthritis, you don't want to do too much exercises that are gonna impact the joint, since it's already bone on bone and there's irritations.
Right.
So what you're gonna be doing would be range of motion exercises and stretches. So most common one that I see, I'm an occupational therapist, so I deal with a lot of hands. So most common one that I see it is the deformities of the joint of the hands, and inflammation, swelling, and pain. So one simple exercise that you could do for the hand is called the tendon gliding exercise. You try to stretch and move all the little joints of the fingers. So what you do, you start like this with the joints fully extended, all of them fully extended. Then you kind of make a hook with the tip of the fingers, just so you could target the tip of the fingers. Then what you're gonna do is try to extend the fingers flat, so you stretch these muscles. Now I call this a tabletop, so you could probably put something on it so all the fingers are straight. Then you try to touch the palm of your hands with your fingers straight down, and then you try to make a full fist, and you repeat this multiple times. And if in the mornings when you just wake up the joints are very stiff, before you even do this, you could just run some warm water on top of it, or a heating pad, loosen up the joint and increase blood flow to the area. So it makes it more flexible, it gives you a little bit more mobility to begin with, to start those stretching exercises.
So one of the major things down here with people doing is tennis. So those impact joints, going back to those impact sports, that cause impact on the joints is what's going to cause more pain. So one of the best exercises actually for you is going to be swimming, because the buoyancy of the water takes the pressure off your joints. So the deeper you are, the less pressure there is on your joints. And you can do all sorts of strengthening exercises in the pool with a lot of less pain and discomfort than you may have outside of the pool. So a lot of times I have patients do a combination of both land therapy, meaning exercises on land, and then pool therapy. The one thing, obviously we can't change the changes that have occurred to the joint. I can't change the arthritic changes. I can't take them back. The only way to do that is to possibly have a total joint replacement, where you replace the whole joint. But what we can do to help it is with stretching and strengthening, because what happens is that you start having a little bit of pain, you change how you're moving, so then certain muscles get tight, so there also then is abnormal pull on your joints as well, which can also cause increased pain. So one of the major things that we can do to help is really teaching you proper stretches, strengthening the muscles properly, because our bodies are also very good at compensating. So obviously our bodies are going to try to accomplish whatever we're asking it to do in the least restrictive way, in the easiest way, in the least painful way. So that also causes abnormal movement that you may not be necessarily doing consciously, but your body does as you're trying to do whatever activity. So really evaluating you and seeing how you're walking, how you're moving, different things, whatever the situation may be that exacerbates your symptoms, can really give us a clue as to what the best treatment plan is for you. So physical therapy really can, and occupational therapy can really decrease the pain and the symptoms that you're having. Like I said, also, obviously, we can't change the joint degeneration, but we can change how the muscles are pulling and the amount of stress on the joints.
Right, and also, just to get a little bit more details on what Emily is talking about. So, increasing the strength and strengthening the muscles the proper way just to protect the joint, but also you could use certain things for joint protection. So let's go back to the hands, because that's what I see most of the times. So if you're doing certain activities daily and you're required to use your hands a lot, they have simple gloves called joint protection gloves that you could buy very cheaply on Amazon. And when you're doing certain exercises, it helps stabilize the joint, it helps with a little bit of compression, and the joints are not moving, gliding against each other, and not increasing that inflammation as much. And also, if after certain exercises you feel like it's painful, you could also add some ice, at the end, just to make sure that you're decreasing that inflammation. And then in the mornings, you could go back to using the heat. So you could kind of alternate. When it's flaring up, you use ice. When it's just stiff, you use the heat.
So physical therapy also there's a lot of tools in my toolbox that I use in order to help support the joint as well. So depending on the situation, there's different taping techniques and different things that I have utilized to really help my patients out.
If you have arthritis, just don't forget, just consult with your doctor and see what's the best possible course of treatment for you, because there's different types of arthritis, the osteoarthritis and then the rheumatoid arthritis. One quick way to know that if you have osteoarthritis, usually the pain is located in one joint or one side of the body. If you have the rheumatoid arthritis, usually it's like bilateral joint. So
it's systemic.
It would be both hands or both knees or both hips at the same time.
But really consulting with your physician is the best plan for you.
Right, and one quick thing before we let you guys go, and there's a lot of people out there, sometimes, they have their grandmas saying that, I feel like when it's gonna rain because my joints are achy, which is really a thing, guys, so don't make fun of your grandma, because really when that pressure changes, it changes the structure of the muscles around, the joint, and also the synovial fluid kind of contract, so they can really feel it, right?
The barometric pressure does change the pressure on your joints, so it's really changing the pressure on your joints that causes people to feel, I feel like it's rain is going to be coming, or whatever the situation may be.
Right, and also when it's very cold, it just makes this joint even stiffer, so that increases the pain. Sometimes also the barometric pressure do change with the rain, so when it's raining, your grandma or or some people can feel it. Thanks again for joining us, and again, if you feel like you have anything that you need us to address, leave it in the comment below, leave us a like and subscribe to the channel. That would really help us a lot. And again, we're so thankful that you decided to look at this video.
Have a great day, and I hope you guys are enjoying the weather like we are.
All right, guys, have a great day.
Bye.
Enjoy the sun, stay healthy, and stay active.